Hello, this is Dr. Adigana from the American Hip Institute, presenting our midterm outcomes of bilateral staged hip arthroscopy. Bilateral hip symptoms are commonly observed in patients suffering from FAI. However, there's a scarcity of literature addressing the midterm survivorship and outcomes in patients who undergo staged bilateral hip arthroscopy. The purpose of the study was to compare the minimum 5-year outcomes between patients who underwent staged bilateral hip arthroscopy for FAI to a matched control group who underwent only unilateral hip arthroscopy. We hypothesized that patients undergoing bilateral hip arthroscopy would demonstrate good significant postoperative improvement comparable to the unilateral group. Additionally, we aimed to investigate how the time between surgeries would impact the PROs. This study focuses on patients undergoing bilateral primary hip arthroscopy to treat FAI. We identified 193 patients with a minimum of 5 years of follow-up, who were then matched one-to-one to the unilateral control group based on age, sex, BMI, label treatment, and tonus grade, resulting in a sample size of 386 patients in each group. We then compared patient-reported outcomes and the rates of achieving clinically relevant thresholds between these two groups. The results show significant improvement in all PROs for both groups, comparable to one another. At the same time, there was no difference in the rates of achieving clinical significant thresholds between both of the groups. The sub-analysis indicated that patients who received the staged procedure less than 9 weeks apart had a higher rate of achieving clinical significant thresholds. In conclusion, both unilateral and bilateral hip arthroscopy patients showed significant and comparable improvement and a minimum of 5 years of follow-up. Patients who underwent the second procedure within 9 weeks showed a higher rate of meeting clinical significant thresholds, suggesting that a shorter interval between staged procedures may lead to better outcomes. Thank you for listening and watching.